name is Murphy. Can I get your name and your date of birth?
Jenna Lafferty, January 4th, 1994.
All right, well, hi, Jenna. I understand that you were recently diagnosed with secondary syphilis and that you're allergic to penicillin. All right, so I just want to explain your treatment and make sure that you feel comfortable with everything.
Yeah, when they told me I couldn't take penicillin, I got pretty scared. I thought there was no more options for me.
Yeah, that's totally understandable. Thankfully, we do have another antibiotic. It's called ceftriaxone, and it's very effective for treating syphilis in patients who can't take penicillin. So syphilis is a bacterial infection caused by Treponema pallidum. It's usually spread through sexual contact and it has several stages. So there's the primary, secondary, latent, and tertiary. Right now you're in the secondary stage, which explains why you have a rash and you're fatigued.
So it can get worse if I don't get treated?
Yes, so if it's left untreated, it can affect your brain, your heart, your nerves, which sounds really scary, but with the right antibiotics, it's completely curable.
So I have some questions about the antibiotic.
Okay, let me go get my pharmacist so I can get you some more information.
Hi, my name is Jessica. I'm the pharmacist. What are the questions you have?
I'd like to know how the antibiotic works and how much I'll be taking.
Okay, so ceftriaxone belongs to a class of antibiotics called cephalosporins. It works by breaking down the bacteria's cell wall so the infection can't spread. You'll receive 1 gram once daily by injection or IV for about 10 days.
And it works like penicillin?
Yes, it's a strong alternative. It kills the same bacteria that penicillin would, just with a slightly different structure.
You might notice some mild soreness at the site, or sometimes like a stomach upset, but those side effects go away pretty quickly. So
make sure to finish the entire course of the treatment, even if you start feeling better. That's the best way to make sure the infection is completely gone.
During the primary stage, it is a small painless sore appears where the bacteria entered the body, usually on the genitals, rectum, or mouth. It heals on its own within 3 to 6 weeks, but the infection remains in the body if untreated.
During the secondary stage, there is skin rashes, often on the palms or soles, and there will be a fever, swollen lymph nodes, sore throat, and fatigue. Symptoms can come and go.
During the latent stage, this stage is hidden. There is no visible symptoms, but the bacteria is still present and can cause damage over time.
During the tertiary stage, this can occur years later if untreated. This can cause serious damage to the heart, brain, nerves, eyes, and other organs, leading to paralysis, blindness, or death.
All right, so I have Jenna Lafferty. She's 31 with secondary syphilis. She does have a penicillin allergy, so we switched her over to ceftriaxone, which is 1 gram intramuscular daily for 10 days. She is tolerating it really well. However, she does have some mild soreness. We need to continue the therapy and recheck her RPR in about 3 months.
Okay, sounds good. So I have that she's tolerating the ceftriaxone well. She does have some mild soreness, and we will document and follow up with the RPR recheck.
All right, awesome. Thank you.
Okay, great. I'll record your allergy and treatment plan in your chart. After your 10-day course, your provider will recheck your RPR blood test in about 3 months to make sure your infection is gone.
Alright, so if anything weird happens, like a rash or any other reactions, I should just call, right?
Exactly. So always let us know if you have any new symptoms or side effects. You're not alone in this, and we will guide you every step of the way.
Ceftriaxone, a safe, effective treatment when penicillin isn't an option. Early detection and full treatment mean full recovery. Complete your treatment. Protect your health. Syphilis is curable. Welcome. Today we're talking about ceftriaxone, also known as its brand name, Rocephin. This antibiotic plays an important role in treating infections, especially when other antibiotics like penicillin can't be used.
Ceftriaxone is a 3rd-generation cephalosporin antibiotic. It works by destroying the bacterial cell wall, causing the bacteria to die. It is bactericidal, meaning it kills bacteria directly rather than just stopping their growth.
Ceftriaxone is used to treat many infections, including respiratory tract infections like pneumonia, UTIs, skin and soft tissue infections, meningitis, gonorrhea, and syphilis, especially in patients who are allergic to penicillins. Sepsis or bloodborne pathogens. It's often chosen because of its long half-life, allowing for once-day uses, typically 1 to 2 grams IV or MI injection, depending on the infection.
Before giving ceftriaxone, always ask about allergies. is contraindicated in patients with severe hypersensitivity to cephalosporins or penicillins, since cross reactions can occur.
It is also not recommended for neonates who are receiving calcium-containing IV solutions like Ringers or TPN because it can cause fatal calcium ceftriaxone precipitates.
Caution is needed in patients with renal or hepatic impairment since the drug is excreted through both the kidneys and the liver.
Common side effects include mild diarrhea, injection site pain or swelling, nausea, headache, rash, or mild allergic reaction.
More serious reactions may include anaphylaxis, C. diff, hemolytic anemia, liver enzyme elevation, and then contraindications.
Monitor for any signs of an allergic reaction, whether that's hives, shortness of breath, or swelling, and stop the medication immediately if these occur.
As nurses, we always review culture and sensitivity results before starting therapy, verify correct dose, and monitor for improvement of symptoms.
Monitor labs, BUN, creatine, liver function tests, and observe for superinfection, especially with prolonged use.
Administer IM injections deeply into the large muscle mass and rotate sites to reduce discomfort. If given IV, infuse over at least 30 minutes to prevent vein irritation.
Ceftriaxone will help the body fight off infections. It's important for patients to finish the full course of antibiotics as they may feel better pretty soon. Call your provider though if you develop severe diarrhea, new rash, or difficulty breathing, and don't mix with any other antibiotics or supplements without checking with the provider first. Avoid alcohol during treatment as it can increase side effects like dizziness and nausea.
Ceftriaxone is a powerful broad-spectrum antibiotic used to treat serious bacterial infections. It works by breaking down the bacterial cell wall. It usually is given once daily and is safe and effective when used correctly.
Always screen for allergies, monitor your patient closely, and educate them on completing therapy, because when it comes to infection, knowledge, safety, and teamwork saves lives.
Wear protection, be selective, and don't get syphilis!
Your allergy, and start over. Record your allergy and treatment plan in the chart. After about your 10-day course, you'll.
Oh, it's so close. I know, we're getting there.
I need it to. All right, Jenna. I'll record. I hate that word. I will record. I will record.
Record!
I feel like I have a retainer in my mouth and I can't say the word.
Did you say
Two.
So I have some more questions about the antibiotic. Okay, let me go get my pharmacist and she'll give you some more information.
I would like to know how this antibiotic's going to work and how much I'll be taking.
Ceftriaxone belongs to a class of antibiotics.
I can't do this! Anna, I understand that you were recently diagnosed with secondary syphilis and you have a penicillin allergy. I just wanted to explain your treatment and make sure that you feel comfortable with everything.
Yeah, I would, when they told me I couldn't have penicillin, I got scared. I wasn't sure if there was any other options for me.
Next scene.
Sorry, we'll do it again.
You getting penicillin today?
Today sepsis or bloodborne.
No.
Oh.
No. Welcome. Today we're talking about ceftriaxone.
You gotta walk.
Wait.
Ready?
Right now?
Right.
As nurses, we always review
Something.
Common side effects include mild diarrhea.
as pretty soon, but it's important to
More serious reactions may include anaphylaxis, C. diff, hemolytic anemia, liver enzyme elevation, and then contraindications, side effects, and
True story.